Welcome to the Deep Dive, where we crack open the latest research to bring you the most vital insights. We're here to equip you, our listener, to be incredibly well informed.
That's the goal.
And today, we're embarking on a really crucial deep dive. It's tailored specifically for you, the gynecological surgeon. We're exploring the dynamic evolution of minimally invasive hysterectomy.
Indeed.
Yeah.
And hysterectomy, well, it remains one of the most common surgical procedures for women. So the continuous pursuit of less invasive, more effective techniques is just paramount.
Absolutely.
Our focus today is on a significant innovation that's rapidly gaining traction: vaginal natural orifice transluminal endoscopic surgery, or Vnotes for short.
No, it's okay. So our mission today is to distill the very latest research on it, right? Directly comparing V-notes to, well, the established approaches like laparoscopic and conventional vaginal hysterectomy.
Exactly. We'll delve into clinical outcomes, patient recovery profiles, some specialized applications.
And really, what these findings might mean for your practice day to day. Our insights are drawn from several really cutting-edge studies published just between 2024 and 2025. So it's a truly current perspective we're offering.
Very current.
All right, let's pull back the curtain on this exciting advancement then. Before we really dissect the hard data, for those listeners who might be hearing about it for the first time, what exactly is V-Notes, and what are the core principles that position it as, well, this promising third-generation, minimally invasive procedure?
Okay. So at its essence, Vnotes utilizes the vaginal canal as the access point. You insert a single port platform.
Through the vagina.
Correct. And this allows standard laparoscopic instruments to enter the abdominal cavity. So surgeons can perform complex procedures, but without any external incisions.
Wow. Okay.
The result is a truly scarless approach, because you're leveraging a natural orifice. And this innovative method, it's already seen successful application across a range of gynecological surgeries, adnexal surgery, myomectomy, and of course hysterectomy.
So what are the theoretical advantages then? What do proponents suggest truly sets V-Notes apart from the other minimally invasive techniques we already use?
Well, the theoretical advantages are quite compelling, actually. Beyond being inherently less invasive and, leaving no visible abdominal scars, which patients appreciate.
Huge benefit.
Huge. Vnotes offers the potential to operate without needing the Trendelenburg position.
Right. Can you remind our listeners briefly what that involves and why avoiding it is significant?
Sure. The Trendelenburg position, it involves tilting the patient head down. The idea is to shift abdominal contents, improving surgical access. But it also places significant strain on the cardiovascular and respiratory systems.
Okay.
So avoiding it, which Vnotes often allows, means easier ventilation and reduced risk. This is particularly beneficial for, say, obese patients who often face higher surgical risks anyway.
That makes sense.
And furthermore, the technique tends to follow the natural lymph node trajectory, from caudal to cranial. Some believe this might lower the risk of missing sentinel nodes, which is especially relevant in oncological staging.
Okay, interesting. Let's turn to those direct comparisons then. Patient recovery is always a top priority for you as a surgeon.
Always.
A recent prospective cohort study, Tang et al., from 2025 looked specifically at patients with high-grade CIN or concurrent benign conditions. They aimed to evaluate rapid recovery outcomes, comparing Vnotes hysterectomy with laparoscopic hysterectomy. What did they find? What were the key recovery metrics showing?
The findings were quite notable, host speaker, particularly for patient recovery.
Yeah.
For instance, time to first anal exhaust.
Right, that key marker of GI recovery.
Exactly. It was significantly shortened in the Vnotes group. We're talking a median time of 48 hours compared to 69 hours for the LH group.
Wow, that's a reduction of 21 hours.
It is. That translates directly to faster comfort and, an earlier return of normal bodily functions for your patients.
And beyond that immediate physiological recovery, what about return to work time? That's such a critical indicator, isn't it, for functional, social, even mental recovery, something surgeons definitely hear about from patients.
That's absolutely right. And here, too, the difference was significant. The median return to work time for Vnotes patients was a full month faster.
A whole month.
Yes, 2.0 months compared to 3.0 months observed in the LH group. And if you look further out, by 4 months post-surgery, over 80%, 81.8% of Vnotes patients were back in employment, compared to just 68.4% of LH patients.
That's a big gap.
It is. And impressively, all Vnotes patients achieved workforce reintegration by 6 months. This really does showcase a substantial reduction in that socioeconomic burden we mentioned.
That's a really powerful impact on a patient's overall life. Were there also benefits in terms of hospital stay or even operational efficiency in the OR?
Absolutely. Looking at that subgroup of patients who returned to work, Vnotes also demonstrated significantly shorter post-operative hospitalization.
How much short?
Patients were discharged nearly a full day sooner, a median of 1.8 days compared to 2.6 days for LH.
Okay, okay.
And beyond recovery, in the OR itself, Vnotes showed a significantly shorter median operation time. That's a clear efficiency gain for the surgeon and the team. It was 20 minutes shorter, 90 minutes versus 110 for LH.
Interesting.
And from the patient's perspective, another notable reported benefit was a remarkably higher cosmetic satisfaction score in the Vnotes group, median of 9 points versus 8 for LH.
And critically, what about safety? Any trade-offs there?
That's the crucial part. The study found comparable safety profiles, no significant differences in surgical complications requiring clinical intervention or in the incidence of postoperative dyspareunia that's painful intercourse between the two groups.
Okay, so when we put all these metrics together, faster GI recovery, much earlier return to work, shorter hospital stays, improved cosmetic satisfaction, and comparable safety. What's the core message here for surgeons? For you navigating best practices and trying to minimize disruption to your patients' lives.
I think the key insight here, really, is that Vnotes offers a robust pathway to significantly alleviate both that physiological stress and the socioeconomic burden.
Right.
By accelerating recovery and facilitating that earlier workforce reintegration, it aligns very closely with the principles of enhanced recovery after surgery, or ERAs.
Mm,
So for you, the gynecological surgeon listening, this isn't just about faster healing in the abstract. It's about getting your patients back to their lives, back to their work, potentially a full month faster than with traditional laparoscopic hysterectomy.
that's a tangible, quantifiable benefit.
Exactly. It directly addresses patient quality of life and those socioeconomic concerns. It provides a really compelling argument for adopting Vnotes where it's indicated.
We've clearly seen Vnotes holds its own and perhaps even excels against laparoscopic hysterectomy in several key areas. But what about comparing it to another traditional, less invasive approach, conventional vaginal hysterectomy, or VH? How does Vnotes stack up against that well-established technique, particularly thinking about surgical nuances, maybe costs for your practice? There's recent research, right? A meta-analysis by Marchand and a single-center study by Malahuzeno Kulash.
Yes, those provide valuable insights. The meta-analysis by Marchand et al. It systematically reviewed 4 studies comparing Vnotes and VH, specifically for benign indications. And it found, interestingly, no statistically significant differences in operation time, length of hospital stay, postoperative pain scores on day 1, or the rates of intraoperative and postoperative complications.
Okay, so if it's broadly equivalent in those core measures, where does the real advantage, or perhaps the difference of Vnotes lie compared to VH, especially for a surgeon thinking about expanding their capabilities?
That's an excellent question. Because while it wasn't statistically significant across all the studies, Vnos did show a trend towards lower estimated blood loss compared to VH.
Okay, a trend.
But I think the powerful takeaway from these comparisons, highlighted particularly by Mullahuzinolu Kulas, is how Vnotes strategically, well, it bridges the gap. It delivers superior visualization and much easier access to the adnexa compared to VH.
Ah, so seeing better and reaching things more easily.
Precisely. And that's critical because it facilitates those additional procedures like self-brachiectomy and oophorectomy, which, as you know, are increasingly performed alongside hysterectomy for various reasons.
Mhm.
Furthermore, that same study observed that Vnotes was often preferred over VH in patients who had a history of previous C-section or other pelvic surgery,
Why is that?
because that wider field of view significantly aids in managing intra-abdominal adhesions. That can be much more challenging, sometimes impossible, with a purely vaginal approach where your visualization is more limited.
Right, dealing with scar tissue.
Yeah.
Okay. And what about the economic perspective? How do these options compare cost-wise?
Good point. Economically, the Mulhouse-Alucula study reported that while VH was indeed the least costly option overall.
As you might expect.
Right. But Vnotes hysterectomy was significantly less costly than total laparoscopic hysterectomy, TLH. To give some context, the reported average costs were around 5,519 Turkish lira for Vnotes, compared to $11,125 for TLH in that study setting.
So significantly cheaper than laparoscopy.
Yes. So it positioned itself as a kind of strategic middle ground. You get some of that advanced visualization better than VH, but at a lower cost than full laparoscopy, while still retaining the benefits of vaginal access, no abdominal scars.
Okay, that makes a lot of sense. We've seen V-Notes' impact on recovery and quality of life in benign cases. But now let's turn to where this innovation seems to be really pushing the frontier, its application in gynecologic oncology, specifically for endometrial cancer staging.
Indeed. This is a very exciting area. A prospective multi-center case series by Bakelant et al., published in 2024, specifically investigated V-Notes for retroperitoneal sentinel lymph node dissection in endometrial cancer staging.
Okay.
And this approach, it offers distinct benefits in the oncological setting. First, it maintains those less invasive and scarless advantages we discussed.
Right.
But critically, it allows for the sentinel node dissection without needing the Trendelenburg position.
Back to that point again. Why is that particularly important here?
Well, it's a significant anesthetic advantage, particularly for obese patients. And as we know, a considerable portion of endometrial cancer patients fall into that category. Avoiding Trendelenburg just makes anesthesia management safer and easier for them.
Got it.
And also, remember that point about the technique following the natural lymphatic distribution from caudal to cranial? Theoretically, that could reduce the risk of inadvertently missing a primary sentinel node during the dissection.
That certainly sounds promising from a surgical oncology perspective.
Right.
What did the study actually find regarding, feasibility in those
Right.
crucial sentinel node detection rates in this complex patient group?
Well, the study involved 64 women with early-stage endometrial cancer, and it demonstrated high feasibility. They successfully identified bilateral sentinel nodes in 97% of cases.
97%, that's very high.
It is. The median operative time was 126 minutes, with a low estimated blood loss, just 80 millilengths on average. And importantly for patient recovery, 30% of these oncology patients were discharged on the same day.
Same day discharge after cancer staging.
Yes. And for those requiring overnight care, the median hospital stay was just 2 days. Pain scores were low too, median of 1 out of 10 at 24 hours post-op. These are really impressive recovery metrics for this patient population.
They really are. Now, while those outcomes are encouraging, what about potential complications or the learning curve? This is a newer specialized procedure, especially in oncology.
That's a fair point. It's true, the technique is newer.
Yeah.
The study did report bladder injury in 5% of cases.
Okay.
However, these were primarily managed conservatively or with surgical repair, and importantly, all patients recovered fully. The authors do openly acknowledge there's a learning curve, as you'd expect with any surgical innovation. But they highlight that the outcomes, particularly coming from experienced surgeons across multiple centers, are highly encouraging and certainly comparable to established laparoscopic procedures for staging. They also noted a specific safety measure, suturing the cervix closed to prevent potential cancerous cells spilling during the vaginal part of the procedure.
That's good attention to oncologic principles. Okay, moving beyond the purely clinical metrics. Patient-reported outcomes are increasingly recognized as crucial measures, right? Like sexual quality of life.
Absolutely essential.
What did the study by Timmermans et al., just out in 2025, find about sexual quality of life after V-Notes hysterectomy compared to conventional laparoscopic hysterectomy?
Right. This study focused on benign gynecological conditions again. It found that in sexually active patients, Vnotes hysterectomy led to significantly higher scores in arousal, orgasm, and overall sexual satisfaction compared to conventional LH.
Higher scores across the board.
Yes. Specifically, they used the Female Sexual Function Index, the FSFI. It's a standard, validated questionnaire. The total FSFI score for the Vnotes group was 28.97. Crucially, this score was above the clinical cutoff of 26.55. Which is the recognized threshold indicating satisfactory sexual quality of life.
Okay, so they were generally satisfied.
Exactly. Whereas the TLH group's average score was 24.99, which is below that cutoff.
Below satisfaction level.
Correct. So statistically, patients in the Vnotes group were more likely to report overall satisfaction with their sexual well-being after surgery.
That's quite a profound impact on a patient's overall well-being beyond just the physical recovery. Were there any specific patient groups that saw particular benefits? Or any other interesting insights from that study?
Yes, actually, a fascinating insight came from their subgroup analysis. They looked specifically at patients suffering from adenomyosis,
Okay.
and it revealed that for these patients, both arousal and orgasm scores
Hmm.
improved postoperatively, regardless of which surgical technique was used, Vnotes or LH.
Regardless of technique, that is interesting.
It is. It suggests that for patients who have adenomyosis, just addressing the underlying condition itself, removing the uterus significantly contributes to an improved sexual quality of life. It's
Mhm.
a really valuable point for preoperative patient counseling, wouldn't you say?
Definitely. Managing expectations and highlighting the benefits of treating the underlying pathology. Okay, so this all sounds incredibly promising. We're seeing consistent positive trends across multiple studies, clear benefits to patient experience. What's next for VNotes? How does it solidify its place in broader clinical practice?
Well, the medical community is, quite rightly, committed to rigorous assessment. There's a major trial ongoing called the Vanola trial.
Vanola.
Yes, it's a multinational, multi-center, randomized controlled trial described by Beeklant et al.
Hmm.
In 2024 as well. It aims to recruit 1,000 women.
1,000. That's a large scale.
It is. And it will compare V notes against both vaginal and laparoscopic hysterectomy for benign indications, but on a much larger scale than previous studies. It's designed as a pragmatic trial, meaning it aims to reflect real-life clinical practice. The participating surgeons are already experienced in all three techniques.
So it's not just pioneers using it?
Exactly. And this effectively moves Vnos into stage 3, the assessment stage of the ideal framework for surgical innovation.
Can you briefly explain the ideal framework for listeners?
Sure. IDEAL is basically a structured roadmap used in surgery. It stands for Idea, Development, Exploration, Assessment, and Long-Term Study. It's designed to ensure new procedures are evaluated really rigorously before they become widespread, confirming those earlier promising results, like the ones we've discussed, but in a broader, more robust context.
That deliberate, systematic approach by the surgical community is really commendable. It ensures widespread adoption is built on solid evidence, not just enthusiasm.
Exactly. This ongoing large-scale research, the Vinola trial, it directly addresses the limitations of earlier studies, things like single-center data or maybe lack of direct randomized comparisons.
Now, what are the main things that trial is looking at?
The primary outcome is the proportion of women who can be discharged within 12 hours of surgery. But there are comprehensive secondary outcomes, too. Conversion rates, surgical duration, complications, readmissions, and importantly, those patient-reported outcomes, like sexual function.
So, really comprehensive.
Very. The cumulative evidence we have so far strongly supports V-Notes as a safe, effective, and in many cases, superior alternative in minimally invasive gynecological surgery. I think the future looks pretty bright for V-Notes becoming a standard of care option.
Well, we've certainly taken a deep dive today into this evolving world of minimally invasive gynecological surgery and the really promising Vnotes technique. From, speeding up patient recovery and improving quality of life to its expanding role even in oncological staging. The research really paints a compelling picture of an innovative approach.
I agree. What's truly fascinating here, I think, is the consistency of the evidence across different studies and different metrics. V-Notes seems to offer tangible, meaningful benefits, significantly faster recovery times, reduced pain, excellent cosmetic results, and that enhanced surgical access, even when dealing with more complex cases like adhesions.
Yeah.
It really positions it as a powerful, patient-centric alternative to both traditional laparoscopic and vaginal approaches.
So, as you, our listener, the gynecological surgeon, continue to navigate the optimal surgical options for your patients day in and day out, perhaps consider this. How might these demonstrated advancements in VNotes reshape the standard of care in your practice? And looking ahead, what further opportunities might this innovative approach unlock for truly optimizing not just recovery, but the overall well being and experience of your patients undergoing gynecological surgery?